What is hypoglycemia? Whenever a patient has blood glucose levels less than 70 milligrams per deciliter, then those patients are at risk of developing hypoglycemia. This threshold might vary from patient to patient. Few patients might be asymptomatic even if GRBS is 70 milligrams also. If it is less than 60, if the few patients are symptomatic, then those patients are hypoglycemic for 60 milligrams per deciliter. And who is more likely to develop low blood glucose levels? Patients who are on insulin, that is type 1 diabetes mellitus, patients with CKD disease, chronic kidney disease, and in such patients using sulfonylureas, patients who are on multiple OHs, and patients elderly patients with more than 65-year-old, and if the patients are ethanolic, and such patients are at risk of developing low blood glucose levels. And what are the symptoms of hypoglycemia? So symptoms of hypoglycemia, uh, if the blood glucose levels is between 55 to 70, then you label them as moderate hypoglycemia. If the blood glucose levels are less than 40, then that is severe hypoglycemia. Symptoms of hypoglycemia may varies from profuse sweating, involuntary tremors, palpitations, and feeling tired, hungry, and feeling dizzy and headache. These are all the symptoms of moderate hypoglycemia. In severe hypoglycemia, patient can also present with seizures, and patient can become unconscious, and such patients require hospitalization and needs treatment immediately. So, what if my blood glucose drops during sleep? Your blood glucose level can drop while you sleep and stay low for several hours, causing serious issues. So, what are the symptoms of low blood glucose when you sleep? You might have nightmares. You might feel sweating throughout the night, and your pajamas or sheets might get damp. You might also feel tired, irritable, confused after waking up. For these, you need to inform your friends and family. So, what are the causes of low blood glucose levels in patients with diabetes mellitus? As I already explained you that patients with who are on insulin, patients who are on multiple oral hypoglycemic agents, or patients who are ethanolic, or patients with raised serum creatinine levels, or elderly patients. So these are all the patients who are at risk of developing hypoglycemia. How would you manage hypoglycemia? Is you're monitoring your blood glucose levels. Do not skip any meals, and you need to have frequent snacks. And if you are preparing for exercise, have some kind of snacks before you exercise. Avoid ethanol, and record your blood glucose reactions.